I'm proud to announce a new effort, the first of its kind, to help Americans grappling with long-term effects of COVID-19 that doctors call long COVID. So we're bringing agencies together to make sure Americans with long COVID who have a disability have access to the rights and resources that are due under the disability law.
That was Joe Biden back in the summer of 2021, finally promising action on a problem that had gone underreported at the height of the pandemic, the ravages of long COVID in millions of Americans who survived the virus. But the president has said or done very little since then, other than putting out 2 online reports calling for future research and spotlighting existing federal aid for sufferers. But where's the ambitious new plan to tackle long COVID? Earlier this month, Virginia Senator Tim Kaine, a close ally of the president's, opened up about his own long COVID symptoms, and he expressed frustration that months of effort in Congress to address the illness have gone nowhere. What happened? The economy took off, hospitalizations dropped off, and we haven't seen a major nationwide spike in deaths since February. The CDC appeared to move on this month when it eased its guidance on masks and social distancing just in time for back to school. Meanwhile, perhaps encouraged by the Biden administration and by the CDC, a lot of ordinary Americans have moved on too. In a new NBC poll concluded last week, voters were asked what they thought was the most important issue facing the country. Every response, including other, got more votes than coronavirus. Only 1% of voters ranked COVID as their top issue, the very bottom of the chart. Look, I get it. There is a growing sense, fueled by both the administration and by the media, that we have vaccines, we have Paxlovid, so the crisis is over. But long COVID doesn't fit that convenient narrative. It could afflict around 13% of all COVID sufferers, an estimated 1 in every 8 infected people, according to a new study out this month in the Lancet Medical Journal. Though some studies suggest the risk of long COVID in infected people could be closer to 1 in 5. Either way, that translates to potentially tens of millions of Americans suffering chest pain, pains when breathing, painful muscles, tingling extremities, heat or chills, heavy arms and legs, general fatigue and more, even half a year after contracting COVID. The good news is vaccines can bring down the risk of long COVID somewhat. The bad news is that they don't prevent it, and so even fully vaccinated people who get breakthrough infections still can and do get long COVID, according to another massive study published in May. And just last week, another Lancet study found that even mild COVID cases can lead to brain fog, dementia, and psychosis over years. But it's mild. It's mild. All this comes as the CDC investigates the deaths of long COVID sufferers, probing how their conditions can lead to other fatal conditions like heart disease and diabetes. And don't forget, despite the vaccines, the antiviral drugs, and the dominant media narrative that the pandemic is all but over, despite the total downplaying of long COVID, even now, 500 Americans are still dying every day from COVID. 500. In other words, we are still losing more people to COVID every week in America than we lost on 9/11. So again, where is the Biden administration on all of this? Just last week, CDC Director Rochelle Walensky acknowledged her agency bungled the COVID pandemic and the promised reforms. Perhaps Dr. Walensky and President Biden can reorient the CDC towards tackling the growing long COVID crisis in America as part of their reforms. This is a country, after all, where treatment isn't free and masks aren't required, but prior authorization by your insurance company is. For more, Dr. Kavita Patel joins me now. She is former health policy director in the Obama White House and an MSNBC medical contributor. Kavita, thanks so much for joining me. It seems America is still pretending life is back to normal, whatever we define as normal. Do you think we in the media and we as a country have ignored in particular long COVID and its effects in an attempt to get back to normal?
Maddie, I do, but it's because it's hard to make headline news out of symptoms that seem vague, and especially when you do have, in fact, trusted experts in science on the media who actually allude to long COVID being, psychological or not a real illness. And so combine that with the fact that the American health system on its baseline is so hard to navigate. It's no wonder that it's difficult to find attention to something where it feels like we're still walking around with a flashlight in the dark, trying to find a needle in a haystack.
And from a policy standpoint, Senator Tim Kaine recently gave a very moving interview in which he discussed living with long COVID and trying to get the White House and the Senate to act. Now he says he stresses to fellow lawmakers and top Biden officials that he spent 2 years feeling as if every nerve ending in my body has had 5 cups of coffee. Senator Kaine fears this nerve sensitivity may be permanent, and he started bringing it up at every healthcare-related hearing, in backroom conversations with colleagues, in speeches and during press conferences. If a top Democratic senator with long COVID can't convince a Democratic president or his colleagues to act, to do more, can anyone?
Well, I hope so. I know this is awful, but there are likely to be more lawmakers and congressmen and women who actually have long COVID, just given the statistics you accurately cited, anywhere from 1 in 5 adults to 1 in 8 adults, or one of their family members. Matt, if you just do the probability, somebody in everybody's family or immediate circle will likely be affected. Here's the ugly truth. I've worked in the Senate. When people ignore lawmakers as prominent as Senator Tim Kaine, it's because they embarrassingly don't want to put money for those efforts, because that money, those dollars, have to go ahead of whatever pet project, kind of lobbyist, kind of highest priority come forward. And that's really the truth, Mehdi. We just don't have the courage and the will to do this. Even the Biden administration putting out a report, it's a paltry $1 billion that went into research. That is, underfunded by 100x when you think about the impact of this. What if I said to you that we didn't have money to study heart disease, cancer? What would happen? This is what we're talking about. Long COVID is a chronic illness, just like that.
And yet over the weekend, White House Chief of Staff Ron Klain tweeted, as POTUS said last month, 3 free and widely available tools we have, boosters, tests and Paxlovid, can virtually wipe out COVID deaths if people use them. And that's true, but none of that really applies to long COVID, does it? That's the problem. Our entire debate, and it drives me mad, about COVID is, what are deaths? What are hospitalization numbers? That's all we talk about, as if there's no other fallout from this disease.
Right. That combined with, you mentioned some of the symptoms of long COVID. We're just peeling back onion layers, Mehdi. We're seeing incredible dental consequences, women with their menstrual cycles. I mean, there's just so many things we don't understand. And at the same time, to your point, we're a very treatment-focused society. Everybody loves to have kind of that silver bullet so that we can say, don't worry, you don't have to fear. We'll give you this set of pills. It'll take care of everything. Well, a novel virus is proving us, we're very humbled by it. Let's put it that way. So we do need the clinical research. I find more from people telling me about their symptoms and putting together these patterns on Twitter, from MedTwitter, from patients, from long COVID survivor groups like Survivor Corps, others. They teach us more than what we're getting from the literature. And Mehdi, that's not a good sign.
That's what's so frustrating. It's a new disease. The idea that we know everything about it and that we can just say, oh, time to get back to normal because people aren't dying, and people are dying. It just seems to me bizarre and irresponsible. Talking of bizarre and irresponsible, let's talk about the CDC. Everyone's talking today about Anthony Fauci's announcement Monday that he'll retire from the CDC. He'll retire from government in December. But the other big news is this shakeup that CDC Director Rochelle Walensky ordered last week after an internal review found the agency didn't respond quickly enough to the pandemic. Did you get any sense from that announcement that the agency, that Dr. Walensky recognized how the CDC still seems to be failing Americans, even now, how it's lost the confidence of Americans across the political spectrum, right and left?
I do. And I think it's very significant, Mehdi, just a subtle policy point, that the woman that they put on point from an external perspective to kind of be in charge of that review was a former Obama official who was in charge of a different agency. That tells you something, Mehdi. They didn't even have a former CDC director from the D or R side in charge of that external review. So that sends a signal that everybody, including Dr. Walensky, has acknowledged that this could be better. But I will say this has been decades in the making. I mean, it's unfortunate that it took this administration to finally realize it, but this is a problem that's just been layered on top of problems made worse by the Trump administration with a decimation of the staff. And I think the true fact is you can't have thousands of scientists and more kind of academic people in Atlanta, Georgia, when we really needed rapid policy making on a minute-to-minute basis and recommendations from the CDC in real time. That's just not something they have the data or the wherewithal to do at this juncture, but I think they can get there. But that external appointment was very significant, and I noticed that.
One last question, Kavita. Today was another back-to-school day for many parents. Another school year is starting in the age of COVID. In New York today, Governor Kathy Hochul announced the end of COVID-19 restrictions, all restrictions in the state schools. What is your takeaway from all this, and what is your advice or message to parents as kids go back to school? Because, you know, again, the dominant narrative is we're back to normal, no need to mask, no need to isolate. Some of us think actually maybe kids should still be masking indoors or taking more precautions, at least indoors.
Yeah, Mehdi, I'm one of those parents, and I won't lie. I've been part of many schools' protocols across the country just to give advice and help. And you're right, not just New York State, the entire country, whatever your state color, red, blue, purple, is pretty much doing away with things. Practical advice. I am reinforcing hand hygiene in kids. I really hope I can double down on talking to my kids' teachers and schools' teachers about really not letting children come into the school sick. I am all for children having in-person learning. That's a high priority. We can do that by preventing contagious any virus. We just don't want kids being sick at school, period. And then in terms of masking, you're right. And what I've been recommending, my own children's school included, is that we try to have children encouraged to be optional masking or encourage masking or not mask shaming. But then on top of that, if there is a class member who is positive, adult or child, that we flip and have a cohort mask for a period of time while they're in quarantine. They can attend classes, they can learn, they can play, but they should be masked until we get that negative test on day 5. And then finally, ventilation.
Yeah.
It matters. Open windows, open doors. Do it when you can.
I feel like that's a battle you and I and others are losing, Kavita.